We get calls from federal lawmakers on the Hill wanting to see the state of the workforce data as they're working on a bill or a piece of legislation, or they're getting calls from their constituents.
One thing I'd like providers to know is that if you get that invitation to do the survey, any effort that you can put in to get that completed can really change policy programs for you and also impact the lives of DSPs and people receiving services.
The access rule is a huge piece of federal regulation that was finalized in 2024. One of the provisions is around payment adequacy, and that speaks to making sure that DSPs are paid properly.
Welcome to IDD Leader, where human services leaders grow their impact, lead with heart, and build the workplaces our field deserves. I'm your host, Nate Beers. Let's dive in. If you're like many other people, you're probably wondering on a regular basis, how could we be doing this better? What are other people doing? And my guests today are going to help answer the question, or at least that part about what are other people doing. And I think you're going to find out some of what could be done better at your organization as well. The guests are Laura Vegas from National Association of State Directors on Developmental Disability Services and Dorothy Hiersteiner from Human Services Research Institute. What do they have in common? Well, they together oversee the National Core Indicators State of the Workforce Study. It's a comprehensive research study that looks at all kinds of things related to the direct support professional workforce. Now, this conversation is part 2, so you may have already caught part 1, or if you didn't, that's fine. You can just jump in right here. But in today's episode, they're really going to go more in depth on different initiatives that states have taken, specific states have taken, to try to improve things for the DSP workforce and how that's gone for them. They'll kind of continue to give us a bird's eye view of what's happening across the country. And in doing that, we're going to hear things that, as far as you're concerned, should shed some light on the kinds of initiatives that move the needle, not just make noise, but actually make things better for your workforce at your organization. So, without further ado, let's get into this conversation. Can you explain the new CMS access rule? We talked briefly about this in the past, prior to not on the recording yet. So, can you briefly explain that, and then how are states prepping for this? What should then at the provider level? Is there anything that the providers should kind of be looking at or preparing for?
So the access rule is a huge piece of federal regulation that was finalized in 2024, and it has a lot of provisions that impact the way states do business for the benefit of people who receive services and supports. And so I think one of the provisions in the access rule is around payment adequacy. And that speaks to making sure that DSPs are paid properly. So I think that tells you that at the federal level, the federal policy level, they're recognizing the workforce crisis, the workforce shortage, and understanding that there has to be some assurances that DSPs are being paid better, at least, at least the majority of the rate that's going in the DSP, their pockets. And so in the payment adequacy provision, there's 2 requirements. One is that states make public the average wage for personal care services, home health aid services, and homemaker services. And so that's kind of for the purposes of being able to compare across states, being transparent in your state so that advocates, the legislator, those kind of people, the general public can see what DSPs are making. And then there's another part of that provision that calls for 80% of the waiver rates to be DSP wages. So 80% of the rate that's paid to provider should go into the DSP's pocket in the form of wages. There are a few things to take in and take out and to consider, but the majority is that 80% of the waiver rate go into their pocket, into their wages. That piece of the legislation only applies to home health aid services, personal care services, and homemaker services. And for our services and supports, the majority of our services and supports probably would fall under that habilitation services category. So that may not impact our system on a big of a scale as it would, say, maybe the aging and physical disability waivers that primarily provide those three services, if that makes any sense.
Okay. Yeah. No, that does make
But I
sense.
I think it's a huge statement at the federal level recognizing that, you know, wages are important and the
Hmm.
workforce is important, and there has to be things done at all levels um, to support the workers.
And if this does raise wages for those three worker types, we don't know. Is that going to encourage people who are working in those habilitation services to move over to other service types because the wages are higher? We're not sure.
Yeah.
Or
Okay.
will they have to start reporting on habilitation services? That's my guess.
I hope so.
I think that's my guess.
Okay. Okay. So yeah, the future's yet to be written, I suppose, and we'll have to see how. Yeah, sometimes there's unintended consequences that can happen with when different initiatives that get rolled out. Okay. So yeah, that's really fascinating.
I think if I were a provider though, I would be looking at my revenue versus my expenses in these categories to see if I'm close, or just to see what my average wage is. I would want to have some idea if I could. The sooner the better of
Hmm.
what that looks like for my organization.
Right. And what that points to is data collection, making sure you're collecting the data that are necessary to report on this. Um,
Yeah, absolutely. Which is kind of, I guess, what you guys are looking at that, helping to pull that, data on the bigger scale. But then I guess providers would need to be looking at their own data closely to really know kind of where they fit or how they're stacking up and all that. Um, you'd mentioned earlier that some states are experimenting or are tying to or are already doing this, but have been tying funding to training or credentialing. I know that actually in my home state of Pennsylvania that there is this whole performance-based contracting is like the language that everyone is talking about, and um, that does have a connection where the rates can be different for different providers depending on kind of what the provider can show the kind of the value or the outcomes, different things. There's a whole, I'm sure I would butcher it if I tried to explain it, but there's a lot of criteria for a provider to submit to the state to show that they're not just kind of at that base level, but that they're I forget what the terms are, but in any case, so I know it's happening in Pennsylvania,
Mhm.
but um, I guess from your perspective, and maybe it's too early to tell, but maybe it's not. How much of a difference does that make for you know for the data? I mean, is that moving the needle? Maybe there's states that have been doing it longer than PA, or even just early data that's starting to show. What are you guys seeing with that?
I think the value-based payment or outcomes-based payment has primarily been in more of the managed care world, and it's just moving over to IDD, HCBS, home and community-based services, and long-term services and supports. I think it's really new to our world. So I'm not sure what difference that's going to make. I know a lot of the goal is to get at better quality services versus increasing DSP wages. But the focus, is improving quality. We had some. I'm from Tennessee, and I worked for the state of Tennessee for quite a while. And we had before I left, we had developed some outcome based payments that basically said if a provider does X, Y, and Z, once that is complete, they get paid, and then they have the next step to complete. So it wasn't that they got paid for a fee for service. They didn't get paid for every unit they provided. They had to meet these requirements and meet an outcome before they got their payment. So it's a way states are trying to raise the level of quality services.
and by including training requirements and competencies in those pay for performance or value based payment plans, it professionalizes the career. It has this effect of also professionalizing the career, as we were talking about earlier. So that means that people see this as a career that they can go into and can follow along this career trajectory, continuing education and learning how to get better at your job. And with that experience and with those that training comes increased pay, et cetera, et cetera. So that's one of the goals of including this training in those programs. But I mean, also providing quality services that advance the values, the progressive values of the employment and choice making and things like that.
Yeah, absolutely. And speaking of training at the state level, um, from what I understand, some they're using different ways of doing it, whether they're pulling from a national training, such as I've heard of College of Direct Support.
Mhm.
I know Relias is a big name when it comes to training. And I guess I've heard some states build their own. I think maybe you guys, I don't know if it was in a conversation with you or somebody else at this point, but I guess what I'm curious is, have you seen particular approaches that seem to really support providers and DSPs on the ground?
From what I've seen, the platforms that are standardized across the state, like if a state adopts one certain training platform, there are a lot of benefits in knowing that the training is the same for everybody across the state. And the portability of the training was a big deal. So before that, maybe you would get training at XYZ provider, but if you left that provider and went to another provider, the training didn't come with you. So it was like you had to start all over again with the training that you may have already had. So I know DSPs really enjoy being able to say, here's my certificate, I got this training, and I'm able to use it and maybe get a better job at another
Mhm.
agency, or at least take it with me if I have to move. So it's an incentive to stay in the field, I think,
Yeah.
to have
And
that portal training. Yeah.
that's a great point. And you made me remember that some of the training programs, particularly in New York, are affiliated with universities and colleges. So there's a credential that comes along with that as
And then
well.
you can actually get college credit for
Exactly.
some of
Yeah.
the
That's
things.
what
A lot of states have. Tennessee had relationship with Lipscomb University here in Nashville, and DSPs were able to earn college credit through some of their training, which was a great incentive for lots of reasons, and really help them, continue their education, but help them improve their career as well.
Yeah, that's cool, and I've heard of that happening, and that's really great. That I mean, I could see how it could be, how it could easily be like an incentive to be able to get college credit for the additional trainings that are happening, and certainly when you think about other professions, like a lot of times once you get whatever that credential is, there may be some state license or there may be some state element, but a lot of times it's, I mean, even across the country, there's certain credentials that they're going to honor it
Mhm.
if you went
Yep.
through whatever it was.
Yeah. Yeah.
So yeah, so I can see how that'd be valuable to try to standardize some of that so that it's not just like, well, I was trained at this place and you were trained at that place, and trying to
Right.
figure out what does that even mean.
Hmm. Hmm.
Exactly.
Yeah. Um, one of the powerful things about NCI, from my perspective, is the ability to compare across states, and this had come up in a previous conversation as well. Can you share an example where a state looked at the data, saw how they stacked up, and then tried to use that to drive change, either at the legislative level, like on the advocacy side, or maybe they were using that to then adopt policies that's going to be affecting providers?
Yeah, sure. I mean, on the advocacy side, well, I wouldn't even say advocacy side. Tennessee, where Laura's from, they have used NCI data in their DSP committees. I can't remember the exact term that they have, where they've gotten together groups of DSPs to talk about the data, talk about what they're experiencing, what they see in the data that's important, and they've written a report that then goes to the legislature to tell them about challenges that they're facing, things that are happening that they agree with and they're happy with, and this, along with other targeted efforts by the DD agency in Tennessee, has led to rate increases and wage increases and other programs that have benefited DSPs. Another example is NCI data back in 2017 had a pretty large role in the the President's Committee on Developmental Disabilities. They come up with a report every year. And that report was used across the country to really raise awareness of the challenges that are the crisis, as we're calling it, of that the DSPs are facing. And states were able to see that they weren't alone. So that's a big benefit of being able to see across the country that you're not alone, that these challenges are being faced, and we can try to address them together.
And I know
Yeah.
states have been able to look across the average or median wage, for example, and look at their neighboring states and go to their legislators and say, hey, we're $3 an hour less than Georgia. And, that the cost of living is comparable, and really make a case for budget increases, and be successful with that. And then some states have gone one more step to use the state of the workforce survey tool after the rate increase was implemented to see if it raised the wages in the state.
Absolutely.
So they've been able to advocate for it, and then kind of, hey, did you put your money where your mouth is?
Right.
Kind of check after the fact, to really see if those increases went into the pockets of the DSPs.
It's also been really interesting along those lines. If a state sees that their wages are maybe they say, oh, well, our wages are higher. Why is our turnover rate higher? They can look and see, oh, well, we are not. We don't. The provider agencies don't offer health insurance, for example, at the same rate that other states do, or they've been able to. New York did some studies to understand whether what the drivers of turnover in their state were, and whether or not they were different than those in other states. I can't remember the results off the top of my head, unfortunately, but this is ways that states have been using the data and comparing to other states to try to get at strategies that they might employ to help support the workforce.
Those are great examples. I had a question that just popped in my head, and I thought I'd just throw out there. What's for state DD leaders, what's keeping them up at night? I feel like I have a bit of a pulse at the provider level, but if we go up to a different to that level of what's keeping them up at night as it relates to their work?
Well, I think there are changes at the federal level that we're kind of waiting to see, what the final result is. So states are kind of in I wouldn't say a holding pattern, but they're waiting for more information before they can kind of continue to plan. Like, for example, the access rule. A lot of states are waiting on sub-regulatory guidance around the access rule to be able to implement the provisions in the access rule. I think, and I think states the workforce challenges are definitely always on their mind. They come up in every conversation we have. NASDDDS actually has a research committee that's made up of state DD directors, and every so often we develop a research agenda of policy priorities, and DSP workforce is always one of the priorities. Along with, this is a little off topic, but I think people who challenge our system to support them better, I think that's really on a lot of people's minds too. Across that comes up in almost every conversation we have. Like, how are we meeting the needs of people who may need more, people who may have co-occurring mental health and developmental disability or IDD? How are we meeting their needs, and also making sure they can still have some sort of quality of life? And those, because of the change in demographics, the folks who are kind of coming into our system look a little different. That's really kind of risen to the top as a huge need and a huge policy decision states are having to make.
along those lines, I just want to reinforce the fact that we work with a lot of states, and the dedication and hard work that the DD systems put into making sure that people have high quality of life is just unbelievable. The state directors and their teams are so passionate and dedicated, and they really deserve a lot of I don't know, kudos, I suppose.
They do. They have hard jobs too, as well as the providers in our service delivery system. Yeah. Working hard.
Yep.
Highly appreciate it.
Yeah. In my experience, these types of positions aren't ones that people sort of fall into. It's
Passion, yeah.
it yeah, I think maybe something about across the board, the wages or it's it's not kind of like the path to riches and fame is certainly not
Yeah.
through working in the developmental disability world. Like
Exactly.
that's not really, so it doesn't really attract that type of people, I don't think. Or
No.
and
Exactly.
so yeah, that
But maybe it
dedication piece.
would if we offered better pay and benefits.
Might be. Or people get as a career path.
Yeah, or people saw it
That's
as
right.
a career path. Yeah, absolutely.
Yeah.
I think everyone in the field at this point would say that we would trade that. We'd be willing to put up with some of the people that think of themselves as a rock star and that
Yeah.
are,
Yes, for sure.
in exchange for the whole like living wage and all this other stuff. So yeah, I would like to exchange this current set of problems for that set of problems.
Yeah, that's
Agreed,
right.
agreed.
Yeah, we could manage that. Yeah, it would be a nice change.
So, I mean, I'm sure the grass is greener on the other side, but nonetheless,
Right. True.
nonetheless. So both of you work at the intersection of research and practice. What's one thing that you wish providers knew about how this data actually gets used behind the scenes in state policy discussions?
That's a great question as well. I think a lot of providers are really well versed in data and how to use data and how to understand what it says about their services and the people that they're supporting. But I wish that they understood that particularly for the State of the Workforce Survey, it's so important for us to get as high a response rate as possible for the data to be actionable, meaning for the state to be able to rely on the data and actually use it for change. And we have many examples of states that have used the data for change. So I think that one thing I'd like providers to know is that if you get that invitation to do the survey, we appreciate so much any effort that you can put in to get that completed and get the data to us and to the state, because it can change circumstances, policy, programs for you, and also impact the lives of DSPs and people receiving services.
I think that's what I would say too, Dorothy, is that, these reports don't just sit on people's shelves. They don't just sit in people's inboxes. States are really taking this data, they're doing deep dives into the data and really are committed to trying to stabilize the workforce, whatever that means, and really professionalize the workforce and make sure DSPs are paid what they should be paid, and doing a lot of advocacy efforts around that. I'd also say, providers might not know this, but the NCI, we have the opportunity in the last couple of years to do a lot of work with our federal partners, CMS, the Centers for Medicaid and Medicare and Medicaid Services, which is where the bulk of HCBS funding comes from, and ACL, the Administration on Community Living. We've had audiences with them where we've done briefings on the data from the State of the Workforce Survey, and it's the first time they've seen anything like that. And so we get calls from federal lawmakers on the Hill wanting to see the state of the workforce data as they're working on a bill or a piece of legislation, or they're getting calls from their constituents. And so this data, it people are taking action,
Hmm.
using it. It might not feel like it, and as Dorothy said, sometimes it takes a long time. But and as Dorothy said, we want to hear everybody's voice because the federal government is really looking at what we're learning about this workforce. The lawmakers are making decisions about policy based on the things we're collecting from this workforce. So it's invaluable at this point, and the only source of data we have about the workforce in the IDD across the nation currently.
Wow. That kind of puts a whole different light on. Um, I'm just putting myself in the shoes of a provider that's feeling a little bit swamped. They get
Yeah.
asked to participate, and
Yes. It's a big ask. It's a
it's
big
it's
ask.
it's hard to feel urgency on something, or the tyranny of the urgent, I guess, what I'm trying to say. And so, you just planted a seed here, which is in my mind, which is to say that in filling that out, it's actually helping. Like, the results of that are going to be going to Washington D.C. to help
That's
make decisions that affect the whole nation. So
yeah.
Right.
that's kind of inspiring. That's kind of like, ooh,
Yes.
okay, I get to be part of
We
something that's so much bigger than me.
we've been
That's
really
true.
fortunate with our federal partners, to be able to talk to them about this and for them to be so interested in it.
Mhm.
Yeah, it's been a great partnership. And yeah,
That's true.
it really is. It's no joke. It's not blowing smoke. It really is. It really is going to the federal level and
Yeah.
influencing policy.
Yeah.
And then what you just said, Nate, yes, it is. It is a burden. It's challenging to complete, and some provider agencies, particularly larger provider agencies, have the infrastructure in place to do this data analysis really fast or comparatively fast. But if I were a provider agency who didn't have that infrastructure in place, I wouldn't want the majority of the responses to be from those larger providers with infrastructure because they probably have different data than I do. And I wouldn't want that to reflect my circumstances, for example. I would want to make sure that smaller providers like me or providers with less data analysis ability were also represented in the data that gets shown. So I hope that
For sure.
made sense.
Absolutely. Yeah. No, you don't want to. I mean, if you're the smaller or maybe even mid-sized, but kind of smaller-ish
Yeah,
provider, you don't want to have only the big names representing the whole workforce,
Yep.
exactly.
because there's a lot of small providers out there, and some of the
Doing an
challenges that they're facing may be
great job.
different. I mean, some are going to be the same, but some will be different as well.
Yeah.
Mm-hmm.
Yeah.
Yeah. Do you know, this is kind of a maybe out in left field a little bit kind of question, but do you know if there's any kind of a research or database? Maybe it sounds so formal. Okay, let me back up. Part of this podcast and my mission is to find the positive outliers when it comes to providers that are bucking the trend. They are actually having low turnover, they're having low vacancies, they're crushing it.
hmm
I am finding them. They may not be the average turnover. They're not the average agency, but there are actually quite a few agencies that are really through various methods and various initiatives, but that are exceptional. Do you know if anyone's, um, again, whether formally or informally, trying to track kind of these positive outliers?
Yes. There's a Moving Mountains award that has I think it's done by Anchor and maybe NADSP, the National Alliance on Direct Support Professionals, and they collect stories, proposals, and they recognize provider agencies that are doing a really great job in supporting DSPs.
But I
I'm
hear what
seeing
you're
that
saying.
I
Like,
might not be
how,
connected
how do
anymore.
you?
Can you hear me?
We can hear you.
Yes.
I think what you might be saying, Nate, is there a way where other providers can learn from the best practices of those providers? Is it being collected in
Yeah.
that way? And I don't know, unless maybe Anchor or NADSP. Anchor is the provider association, so they're like the National Association for Provider Organizations. And NADSP, as Dorothy said, is the National Alliance for Direct Support Professionals. So they would probably be looking more at that level.
Yeah.
if that is something that's available. But I've always been curious about that too. We have several great providers here in Tennessee, and they've unlocked the secret. Every provider's done it in a different way, is the thing. Like, some is through, the way they supervise people and the way they support people, and being really lean at the top and then other things are really supporting providers and mentoring, and I mean DSPs and mentoring. So yeah, it would be interesting to see, to have all those where you could study that and try some of those things in your provider
Yeah.
organization.
Yeah, that's something that
Yeah.
has been on my
DSPs
mind. And
and
I
agency governance is a big one.
Yeah.
okay.
Sorry.
Okay. Yeah, no, that's all right. And I mean, I have heard of the Moving Mountains Award. In fact, two previous guests were from providers, Dr. Mike Strauss in Kansas with Good Life Innovations, and then actually Laura in your home state from Tennessee, Core Services of Northeast Tennessee.
That's who I'm thinking of. Yeah, you're
Yeah.
reading my mind. Yeah.
So yeah, and there are many other agencies too. So not at their exclusion, but those are two that really do stand out, where their numbers, I mean, just the data when it comes to their workforce, also their client outcomes, and I'm sure that's
I
not
was
an
gonna say,
accident.
and if you look at their quality, you will
Yeah,
see
it's
it's
outstanding quality.
amazing.
Then and their workforce, like they have, like it's come together. But one of my thoughts has been, as I've continued delving into this world with the podcast and everything else, is like, man, there needs to be. I don't want to mess up a good thing by shining a light on it in a way that then, like, don't put the spotlight here. We're just doing our thing. But at the same time, unless you have a model to go off of, it's real easy to just sort of look at like, well, we see that it's a problem and we see it's complex, right? Turnover is not a simple thing, or any kind of workforce issues. These aren't simple things. You talk about, the funding or advocacy work. This isn't simple. There's a lot of factors that are going into it. And so trying to see where are those positive outliers and what can the rest of the field learn from them, or in some cases replicate. I mean, you're not going to replicate everything, but there's something secret in the secret sauce, and I'm trying.
Yep.
So want to find it. So I was just curious. I thought I'd throw that out there to you guys if you were aware of anything, and those are a couple good leads that you gave me. So thank you.
One thing that the State of the Workforce Survey tries to do, one of the benefits, I think, is that in asking about specific recruitment and retention and DSP support strategies, we're also sort of raising awareness of those strategies. So, for example, we ask about a realistic job preview and we describe it. A provider agency might read that and go, oh, maybe we should do that. Oh, I like to think that happens sometimes.
Yeah. Yeah.
I'm sure that it does. And that being aware of what other people are doing always has that kind of mirror effect of like, well, wait a second. Now, how do I look in comparison to that? I mean, not just for other people's sake, but even from our own results, for our own, at our own place. So, well, kind of looking at wrapping up here, where can provider leaders or state association folks or anybody like that go if they want to dig into the workforce data or learn more about your work? And I'll certainly link anything up in the show notes. But
sure, is
there somewhere besides just the? I mean, I can give them the NASDDDS website, but anywhere else that we should put in the show notes or send people.
Yeah, the NCI.
Yeah. National Quarantine. Yeah.
Okay, so you send me that, and then great, and then I mean, a lot of the work that you guys are doing probably gets captured between those two places if they're looking into those things, and so yeah. So in case anybody wants to follow up, they can look there and
if they have questions too, Nate, feel free to put my email out there. I'll get back to folks as fast as I can. I may not be able to answer their questions, but I could, at least on the state level, kind of direct them. I don't know who to talk to on their state level if they're interested in that, or if they just have questions in general. I'm happy to hear from folks.
Okay, wonderful. Yeah, no, well, we can put those in there as well. Well, this has been just tremendously valuable to learn more of the work that you guys are doing, but then really to see kind of how the different aspects all interact with each other. And so thank you very much for your time. It's been a real pleasure on my end.
Us too. Thank you, Nate.
Thanks for the opportunity. Yeah.
Wow. Well, Did you hear that? When you fill out the survey, if indeed your organization gets, requested to fill it out, you're actually helping to shape the future of American policy when it comes to individuals with developmental disabilities and the organizations that support them. That is so cool, even though it probably is going to be a decent amount of work depending on what infrastructure you have in place to be able to answer those questions. But by all means, I would strongly encourage you to do it. Also, I try to leave you with some kind of specific next step besides just waiting for a survey to arrive and participating in it. And on this one, what I would say is think about the different initiatives that we just covered in today's episode and which ones have you not tried yet, and really start to consider, is that something that we could implement at the provider level? A lot of what we talked about in our conversation was at the state level, but oftentimes providers can just not wait for someone else to go and solve their problems, but can say, you know what, we're going to do something about it right here, right now. It's not going to pass us by. And so that'd be my encouragement, is to pick one thing, an initiative or an approach that was mentioned, and seriously look at, is that something that's worth pursuing in the near term future at your organization? Also, if you want to get a resource that I think will help you, I've got a turnover fix playbook that really looks at supervisor habits, and it gives you very simple, very implementable action steps to be able to help your supervisors level up their leadership, which in turn, of course, makes the work experience so much better for those on the front lines. You can get that for free as a download at iddleader.com/supervisor, and I think you'll find it to be tremendously helpful. Well, until next time, here's to you. Keep up the amazing work.